Okay, so here we go with lesson one. Lesson one is recognizing and responding to an emergency and kind of how we go about that process. So we're going to take you through some of the Red Cross slides and make sure you understand kind of how they work and what we're kind of looking at in this process. So here we go. So in an emergency, what we're looking for very simply is that you have four actions you can take. The first thing is you got to recognize that the emergency actually is there. Secondly is you need to make a decision to take action, and part of that decision is your understanding of the space around you and making sure you're not putting yourself in danger. Thirdly then is to activate the emergency medical services. So for you guys, this is 911 and how we go about that process. And then lastly, give care consistent with your knowledge and training. So this is super important. Make sure that you are giving care within your training. So you are not going to perform heart surgery. You are not going to perform brain surgery. You are simply going to revolve your care around what you've been trained. And so you'll need to think a little bit about that as you go along. Okay, so this lesson involves a couple of videos. And it's going to involve some pausing of the video for you in order to go and answer some questions. And so I'll put in some things in there. When I say to pause the video, make sure you hit pause, and then you're going to jump over into Google Forms. So we'll talk a little bit about that as we go along. So here we go. The first video we're going to watch is about how you handle and recognizing and responding to an emergency. So here we go.
Can you believe they're catching the game last night?
It was amazing. You know, I thought it was over. I was ready to turn the TV off and go to bed.
Yeah. But they got lucky. They had no business winning that game.
Look, a win is a win.
Yeah, right. Oh, check him out. That guy looks like he was out on the field.
Seriously, though, you think he's okay?
I would assume so since he's out and about, but how can you tell? Hello? I gotta get to the office.
Yeah, me too.
Yeah. Okay. We'll get those documents over to your office later today, then we can discuss where to go from there. Sound good?
Help! Help! Please. Dad, are you okay? Help! Dad, someone help my dad, please.
Sir, are you okay? Sir, are you okay? Call 911. Get an AED and first aid kit right away.
Yeah, we have this at the store. Dad!
It's okay. He's calling 911. Did your father complain about anything before he collapsed, or?
He was complaining about not feeling well, but he always complains, and then he just collapsed out of nowhere.
Do you know if he's allergic to anything?
Allergies. Aspirin. He's allergic to aspirin.
Does he take any medication, or?
I don't think so.
Okay, so what you're noticing in this type of response is thinking about all the bystanders. Now, if you pay back attention and if you would wind this thing back, you'll see some people that actually walk right by. And that's one of my big things with you guys is making sure that you are willing to jump in and be part of what's going on. You don't have to be the direct care person. Maybe you're the one who calls 911, or maybe you're the one who goes and gets the AED. But whatever it is, you do have the ability to react. Okay, so thinking back on that situation, what were some signs that you might have thought about when you saw that guy walk through? What were the things that those two gentlemen paid attention to as we go? And kind of how would you respond in that situation, and what roles could you take? All right. So deciding to take action is sometimes a really scary thing. So what I'm going to ask you to do now is I'm going to ask you to pause the video, and you are going to go over to the Google Form link that's at the bottom of this Google slide, and it will take you into some work that we're going to do around these questions. So go ahead and hit pause now, and then jump over into Forms and get ready to go. All right, well, welcome back, and thanks for continuing your work. A couple other things I want you guys to think about is a little bit more on kind of what are some of the laws that go along with things. So here, for example, is something called the Good Samaritan Law. This is a big deal. The Good Samaritan Law is a big part of first aid care, and what it says is that you have the ability to help within your level of care and to volunteer to be part of an emergency situation as long as you work within your level of training. And we talked about this a little bit before, but keep that level of training as a priority for you. But you will always be covered by the Good Samaritan Law when it comes to somebody suing you or something like that, as long as you work within your level of training. So again, don't take this too far, but be very smart about how you go about this process, okay? So why don't you jump over again, hit pause one more time, jump over again and answer the question about the Good Samaritan Law. Okay, so the next piece here is let's identify what are some life-threatening conditions. So I want you to think a little bit about just kind of in your mind, what are the life-threatening conditions that might come into play on something like this, okay? So what we're talking about is things like heart, maybe choking. I'm gonna stop there. I'm gonna ask you to push pause one more time and you're gonna jump into question 3 in the Google form that you're working on right now. What are some examples of life-threatening conditions? Just take a guess, come up with 2 or 3, maybe 4. So activating the EMS system, this is a really important process, is when do you do it? So when do you call 911? Or when do you say, you know what, the person's okay, and they just need to rest? So these are some cues. If they're unresponsive in any way, you should call 911. If they have an altered level of consciousness or they're very confused, 911 is important. Any breathing problems, any bleeding, severe vomiting, which means something where you cannot control it, any sort of passing blood when somebody might go to the bathroom, these become really important. And then signs and symptoms of some sort of threatening medical condition. So this would be heart attack, stroke, that kind of thing. You need to activate the EMS system. Here's a few more. Big burns, any injury to head, neck, or spine. Really, really bad broken bones. I do want to caution this. If you break an arm, you break something that can be transported without an ambulance, without 911, don't be afraid to transport someone like this with a vehicle. But if it is a compound fracture where you might see the bone sticking out, those kind of things, those are different. Poisonings that could be causing some sort of allergic reaction or be life-threatening. And then if a seizure is something that's new, something that's never happened to that person before, that should be a 911 call as well. Okay. One thing about giving care, make sure you get permission. So you very simply will say to the person, tell them your name, tell them you're trained in CPR and first aid, and then say, is it okay if I help you? Okay, if they're conscious, we obviously can get that response. If it is a child, try to ask the parent of the child if it's okay if you provide care. And please remember, if they say no, then you must kind of just monitor the situation, sit back and wait until either they go unconscious or someone else comes to help them. And you're gonna, if the person is unconscious, then you don't need consent. We call that implied consent. And it is something that we will be able to help with along the way. Implied consent says, go give care no matter what, okay? And then lastly, if they do not give consent, like I said, make sure you call EMS and just monitor them from maybe a short distance in the process. So let's take a look at this video. Here we go.
Now that you have recognized an emergency and decided to take action, follow the emergency action steps. Check, call, care. Before rushing to help an injured or ill person, you need to check the scene, so stop and look around. By answering the following questions, you will gain the information you need to proceed. Is the scene safe to enter? Hazards such as fire, spilled chemicals, and traffic, to name a few, could endanger you or any bystanders. If the scene looks unsafe, Stay clear and call 911 or the designated emergency number. What happened? Check for clues that might tell you the cause of the emergency. How many people are involved? In an emergency with more than one injured or ill person, you may need to prioritize care. What is going on with the person? Form an initial impression about the nature of the person's illness or injury. If you see severe life-threatening bleeding, take action to control the bleeding using any available resources. Is anyone else available to help? Bystanders may be able to provide valuable information about the situation or the person, along with getting needed items, controlling crowds, and reassuring the injured or ill person. Once you've checked the scene, you need to check the person. If you are not sure whether a person is unresponsive, shout using the person's name if you know it. If there is no response, tap the shoulder for an adult or child, or the bottom of the foot for an infant, and shout again while checking for normal breathing. Check for responsiveness and breathing for no more than 5 to 10 seconds. If there is no response and the person is not breathing or is only gasping, the person needs help right away. This brings us to the second emergency action step: call. Unresponsiveness, trouble breathing, and severe bleeding are all signs of a life-threatening emergency. If your initial check reveals these or any other life-threatening conditions, make sure that someone calls 911 or the designated emergency number right away. The final emergency action step is to give care according to the conditions that you find and your level of knowledge and training. Always remember, check, call, care, and you'll be ready to respond to any emergency.
Okay, so just to review, again, make sure the scene is safe. Try to get a feel for what might have happened. Try to get a feel for how many people, and then what condition those people are in, and what your next step might be. Part of your job here is to really overview the people, and we're going to talk about a strategy in this in a little bit. But kind of get a feel for if there's life-threatening, or if somebody's unconscious, or if it's just somebody that's conscious that might need some light care. And then from that, think about what you're going to need. You're going to call 911. You're going to try to access other first aid equipment like a first aid kit or an AED, and then you're going to do your best to provide care for bleeding if needed. So here you can see some options here, but we're going to actually jump you back over into the Google Slides in order for you to, into Google Forms in order for you to check out some situations and how you think you'd react. So here we go over into those. So pause the video now and jump back over into that Google form. So there's a little bit of information here about calling or caring, and just so you kind of understand, you always call first if there's a heart issue. But you're going to care first if there's some breathing situations like choking or some sort of bleeding things, okay? But if you know the person has had a heart attack or having a heart attack, get that call made right away, all right? We're going to call first if the person is anybody who's 12 years or older and they're unresponsive. So that means they look unconscious, those kind of things. Any child that you saw collapse or any unresponsive child who has some heart issues, or you might know that ahead of time. Then you're going to call first. Again, you're going to call first if the person is choking, if the person is, in this situation, you're going to care first if the person's choking, if the person is experiencing an allergic reaction. So you got to get some care to them right away. Taking the phone call or making the call might cause problems. And also if you see life-threatening bleeding, then we're going to care first. One of the things we are obviously paying attention to now, you probably heard this on the news, is PPE or personal protective equipment. Anything you can find, gloves, face shields, those type of things, breathing barriers, really, really important. You can see in this image that there are some products by the Red Cross that do help you with those. All first aid kits and all AEDs should have a set of gloves in them, and we really do strongly encourage you to use those gloves. So, all right, on this slide, I want you to pause it, but I want you to keep it in front of you, and I'd like you to take some notes on this. So what do these letters mean? Signs and symptoms, allergies, medications, pertinent medical history, what the last food they drank, and events leading up to the incident. So this is if you find somebody who needs first aid care and they are able to communicate with you. Okay, so we use this acronym called SAMPLE. If you could jot that down, I think that would be perfect. So hit pause and write this down in a notebook of some sort. We will be putting this into our Google form in a bit, and it's also on your final test. All right, so let's take a look at what this looks like.
If your initial check of a person reveals that she is responsive and awake, get consent to provide care. If she does not have any life-threatening conditions, gather additional information by asking questions and performing a head-to-toe check. Begin by interviewing the person, or if necessary, any bystanders. Use the mnemonic SAMPLE as a tool to remember the interview questions.
So what's going on? Are you in pain?
My arm really hurts. I tripped and fell.
Okay. How are you feeling otherwise? Do you have pain anywhere else? Any shortness of breath, chest pain, or dizziness?
No.
Okay. Let me ask you a few more questions, and then we'll take a look at that arm. Is that okay?
Mm-hmm.
Are you allergic to anything?
Penicillin?
Okay. And what happens when you take penicillin? Have you ever had a severe reaction to it?
No, just a mild rash.
Okay. Are you taking any medications currently?
I'm on blood pressure medication.
And when did you take it last?
This morning.
So do you have any other medical conditions?
No.
When was the last time you had anything to eat or drink?
This morning, a bowl of cereal for breakfast. It's a couple
Okay.
hours ago.
So tell me what happened right before you hurt your arm.
I was going to lunch and I tripped over a crack in the sidewalk. I'm just so clumsy.
Oh. I've been the same myself. Don't worry about it. And did you hit your head when you fell?
No.
Okay, that's good.
Once you've asked the person these questions, look at and gently feel each part of the body from head to toe, checking for signs of injury or illness.
Okay, I'm going to check you now for any other injuries. Do you mind if I touch you?
I don't mind.
Okay, I'm going to start with your head first. I'm going to take a look first. Okay. Does this hurt?
No.
And this?
Mm-mm.
Okay. Now take a deep breath for me. And breathe out. Does it hurt to take a breath?
No, it doesn't.
Okay. And are you having any stomach pain?
No.
And are you having any hip pain at all?
None.
Okay, that's good. I'm going to take a look at your leg now, okay?
Okay.
Does this hurt?
No.
And this? Ooh, it looks like you have a bruise there. We'll take care of that too, okay?
Okay.
And can you wiggle your toes for me? Are you in pain?
No.
Okay, good. Does that hurt?
No.
How about this?
Doesn't hurt.
And can you wiggle your toes for me over here? Any pain?
No pain.
Good.
Okay, so as you see this video and you see it progressing, you can see her run through the sample steps. And I know some of this seems maybe a little bit over the top and a little overkill, but what you understand is that she's getting a really good picture so that in some of these situations when you would need to report information to an ambulance or an EMS provider or a hospital situation, you would have some information. And this is that next step in getting comfortable with your vocabulary and comfortable with your conversations, which we'll be working on in just a minute.
You feel your arm now, okay?
Okay.
Does this hurt?
No.
And this?
No.
Can you wiggle your fingers for me? Good. Okay, I'm gonna feel your injured arm now, but I won't touch the bruised area, okay?
Okay.
Does this hurt?
No, it doesn't.
And this?
Nope.
And can you wiggle your fingers for me? Good. Are you having any back pain?
None.
Good. Let's take care of those bruises now, okay?
Okay.
Once you've completed a physical check of the body, provide care for any conditions you find. If necessary, send someone to call 911.
All right, so that looks pretty straightforward, pretty simple. So you can see the sample piece here, then you see the head and toe check as well. And then we're gonna kind of wrap this session at this slide. And I'm gonna flip you over into what you see as a Flipgrid link at the bottom or on the next one of these Google Slides. Now, before you get to the Flipgrid, and there'll be some information there, you're gonna probably need to identify a brother or a sister or a parent who's willing to help you. Could be a friend, as long as you're being safe in that way. And then I'm gonna ask you to go through these sample steps with that while you have the Flipgrid piece connected. So again, you might wanna review these, double check your notes, double check the Google form. Also, when you're done, make sure you hit the submit button on the Google form as well, and then you'll jump over into the Flipgrid as soon as you're done. So I appreciate you focusing in. I know this was a little longer, and some of these will be, but it's important that we see these in a step-by-step process. Feel free to go back and review any of the things that you see here, and make sure that you have the ability to review any of the necessary things that you might need to have. So other than that, I think we're good to go. I am going to push stop here, and then we will be moving forward with this, finishing this lesson 1, and then you'll see in a few slides, you'll see lesson 2. So after you're done with the form and you're done with the Flipgrid, you should be good with lesson 1. So I appreciate your work, and I appreciate your time. Take care, everybody.